thank you for joining us today. I will be your host. I'm Adam Thacker, the Chief Operating Officer. And it's my pleasure to be joined by Tim Benningfield, our Director of Emergency Medical Services. So Tim, thank you for being here today.
Adam, you of all people know that I appreciate an opportunity and an audience to tell our community how much that EMS is just grateful to be a part of this community.
That's great. So as we talk around the hospital, we're often talking about patients in the hospital, the care that they're being delivered when they leave the hospital, but more recently there's been a concerted focus on an extremely important aspect of care, and that's pre-hospital. And that is where EMS comes in, responding to emergencies in the community, but it's much broader than that. So maybe start off with what is EMS, what does that entail, and just a kind of education for the viewers.
All right. Well, emergency medical services, most people would think is synonymous with the ambulance service. Basically providing emergency transportation to the sick and injured in the community, whether that be from home or the highways. And oftentimes it's elsewhere as well, as a regional hospital that sometimes has to transfer patients to other locations. We are also typically the first organization within the hospital to get that call and determine what the needs are. So transportation of the sick and injured within the community and sometimes outside of the community.
Yeah, and I think an important distinction, because you mentioned ambulance. A lot of times EMS, ambulance, synonymous. They think the sirens and lights flashing, but not only emergent care, you're providing non-emergent care, transferring patients, responding to non-emergent events.
Absolutely. A lot of people don't realize that patients that arrive at the hospital to have an acute situation managed still need an ambulance to take them back to their residence, whether that is a skilled nursing facility sometimes or even their resident. The fact is that if they have a medical reason to warrant an ambulance, then they will benefit from the ambulance service, and especially our relationship and our existence within Good Samaritan.
Yeah. So let's talk a little bit about EMS services and the structure that entails. Number of trucks, number of staff. You know, you're covering a large geography, and I think sometimes we think of Vincennes and we don't think Knox County, surrounding counties. So talk a little bit about your team structure that we're able to cover the entire county and even beyond.
Absolutely. We staff 4 ambulances every day. 2 of those ambulances are at a station here on campus. One of the ambulances is staged at the fire station at Bicknell, and one of the ambulances is staged at the fire station in Wheatland, which is Steen Township. We staff those ambulances with 2 providers. Typically, we have a paramedic on 3 of those, and we have 2 EMTs on one of those trucks. So we're staffing 24/7 with 4 ambulances. And I think the thing that I'm proudest of, and I love to make sure the community knows, is that over 90% of the geography of Knox County is covered with an ambulance within 10 miles. As you mentioned, Knox County is a large geography, and being able to do that with those 4 trucks is impressive. But even more so is the fact that 93% of the population is covered by those ambulances. So just because of the population centers, over 93% of the population of Knox County has an ambulance within 10 miles every day.
Yeah, and the time to response is everything, right? I mean, when you have a true emergency, that time to response is the difference truly in life and death in some scenarios.
It absolutely can be. Just as important sometimes is the perception.
Yeah,
and that's pretty important to us as well, to try to manage our response times. Keep them to a minimal. That way there's no wait time any more than has to be by driving, by miles driven, or by the fact that sometimes those ambulances are busy on other incidents.
Yeah. You mentioned Bicknell, Wheatland, and would be remiss if we didn't call a shout out into partnerships with elected officials, with communities that have really made that possible, and those partnerships have taken this to that whole next level.
I would have to sit here and I know I would miss someone, but I can tell you there are 23 elected officials that are directly involved in the provision of EMS in this community. and all 23 of them have personally supported every effort that we're making. And I think that is amazing.
Yeah, that's a testament to the buy-in from the community. Absolutely. To have such a service. So we talked about trucks, and on those trucks, you've got your staff, paramedic, EMT, maybe a little education on the distinction and how the staff work together.
Right. So there's an EMT, emergency medical technician, on each ambulance every day. There's also a paramedic, which is an advanced level provider. We distinguish the difference between our ambulances by advanced life support and basic life support. That's basically the difference between an EMT that has approximately 200 hours of training and clinical education that are able to provide basic life support functions, manage airways, administer some medications, and basically transport people to the hospital. Paramedic, on the other hand, that advanced life support provider is trained closer to what you would expect with a nurse, but has a different scope of practice than the nurses internal to the hospital. Paramedics are going to manage airways more aggressively with more definitive equipment, start intravenous therapy. They probably have a scope of practice that includes over 70 medications, heart monitoring, defibrillation, the skills that you see on the dramatic TV shows.
Sure.
We're doing those in the back of an ambulance or sometimes in the living rooms.
Yeah. Just another example of team-based care as we use across the organization, whether it's a nursing floor, a physician practice, or the back of an ambulance. So 24/7, 365. There's no holidays off. There's no. We're always kind of at the ready for what comes up.
Absolutely, rain or shine, storms. Just last evening, as a matter of fact, everyone knows, and we were out in the middle of it.
Right. On an annual basis, how many calls are you responding to?
So 6 months ending June the 30th, we had responded to over 3,200 calls. And of those 3,200 calls, we actually transported over 2,600 patients. So we're going to expect to transport in the back of an ambulance at least 6,000 patients somewhere this year. The majority of those patients are coming here, but as I mentioned earlier, some of the patients are going elsewhere, and some of the patients are actually leaving here to go elsewhere.
So what else, from an EMS standpoint, what do you want the community to know and understand about emergency medical services?
I think I always want to make sure that the public understands that the relationship that our EMS department has with Good Samaritan as a whole has made this endeavor the positive that it is. There are options in any community as to how you perform EMS, and this was the right thing to do for Knox County. Having EMS within Good Samaritan has been the key to the success, and I think the staff shows that. I think the community sees it, and I think that they are grateful. I mentioned earlier that the local governments have been so supportive. One of the things that they've recently have done is they've approved our capital plan for the next several years, 5 to 10 years, as a matter of fact. So we're grateful for that. That means that we're going to have new equipment on the streets and on the trucks regularly. We're not going to suffer from any old equipment, any mechanical issues with trucks any more than what you expect. And I really appreciate the support that Good Samaritan has given. As you know, was recently over $300,000 capital investment into our garage to park our ambulances. It's already had a profound effect. You don't have to listen to ambulances run 24 hours a day, so I'm grateful for that. And then the fuel savings that we're experiencing from that are I'm just delighted at that.
Yeah. Well, to echo, as you said, a lot of individuals went into making this successful. Certainly would also thank you and show some appreciation for your leadership and coming in at a time that we were building this and putting it together, and it's been something that we receive overwhelmingly positive commentary about in what can be very difficult circumstances with responding to emergencies and many times being the first on the scene. So thank you for your leadership, and
Thank you.
I'm going to say thank you to all of our viewers, and hopefully gained a little insight into emergency medical services and what goes into being ready 24/7, 365 and creating a safer, healthier community.